Happy Wednesday, everybody. It is Andrea Leonard. I am a 33-year cancer survivor and president and founder of the Cancer Exercise Training Institute. One of the things that I've found in my 25 years of working with cancer patients is that probably the most overlooked piece of information is lymphedema. Lymphedema is swelling of the area, it's typically an extremity, following removal of or radiation to the lymph nodes. In my experience, probably 95% of cancer patients are never even told about this. And in my opinion, it is needless suffering because it could have completely been prevented in most instances. So as a fitness professional, one of the greatest gifts that you can give to any of your cancer patients that you're working with, regardless of if they just had surgery or they're 20 years out, is to educate them about lymphedema, because they've probably not even been told, or it's been minimized, or they've been told it's never going to happen to them. The problem with lymphedema is it can happen anytime after surgery or radiation. It doesn't matter if it's immediately following surgery or if it's 25 years out. The risk does not lessen or increase based on time, but things that affect it are extra body fat, because the adipose tissue actually interferes with the flow of lymphatic fluid. As someone ages, that also increases the risk. If they have an infection, because after all, our lymphatic system is designed to fight infection and protect our bodies. So if the lymphatic system is compromised, either by removal of lymph nodes or radiation, then it can't do the job that it's supposed to do. So if you imagine a freeway, and there are typically 4 lanes of traffic, and every morning between 8 and 9 a.m., you've got a million cars going through those 4 lanes of traffic. Well, what if we close 2 of those lanes? You have the same million cars going through, and then you potentially get a backup. Well, that's the same thing that happens with lymphedema. So therefore, it makes sense that the more lymph nodes that are removed or irradiated, the greater the risk of lymphedema. There are a couple terms that you can familiarize yourself with. One is a sentinel lymph node biopsy, and that is typically when one lymph node is removed. They inject a blue dye into the tumor site, and the dye travels into the lymph nodes, and the first lymph node to turn blue is considered the sentinel node. They remove that node, send it to pathology, and if it comes back negative, then usually they just stop there. If it's positive, they go in and take a larger section, or they do a complete lymph node resection or dissection. There are a number of different terms that are used. But either way, whether they've had one node removed or 30 in some cases, they are at risk for lymphedema. It's just that the risk is lesser or greater. So what does that mean to us as fitness professionals? If you are working with a cancer patient, you need to find out if they've had lymph nodes removed or if they've had radiation. If they've had nodes removed, it's very simple to ask them where. Have them point to a part of their body, even if they can't tell you exactly. And if they don't know how many nodes are removed, just the simple fact that they've had any removed, they're at risk of lymphedema. If they've had lymph nodes removed or irradiated in their neck, you're going to look for swelling into the facial area and the neck. It is the one instance where it actually goes upward instead of what seems natural, which would be to pull downward with gravity. If somebody has lymph nodes removed, let's say following breast cancer treatment, so they might have a sentinel node biopsy or an axillary node dissection, which would be in the armpit, then you're going to look for swelling anywhere from the fingers all the way up the arm. It could potentially be in the pec area or even the lat area, but only on the side that was treated. And then, of course, the same thing applies to the other side. Let's say somebody has had radiation to the chest area, then they are going to be at risk in the chest area into the abdominal area. And then moving down the body, if they've had radiation in the abdominal area, we're going to be looking for swelling here into the pelvic region and down the legs all the way to the feet and toes. And they're at risk on either side. We don't know if it's going to be the left or the right. So when you first meet with somebody, you're going to take measurements of the affected part of the body so that you have something to compare to later on. Now, this is a lot of information, and I'm consolidating an entire chapter in our Cancer Exercise Specialist Handbook, but it's so important. I want you guys to at least have a little bit of this information. The other thing that is super, super important and very much overlooked is to start and progress slowly. I see so many trainers working with cancer patients, and honest to God, they must not have a clue what they're doing, and they're pushing the cancer patients way too fast. I don't care if they were an Olympic athlete. After these procedures, they are not the same person physiologically. Can they be? Absolutely. But if you progress them too quickly, you can actually make the lymphedema, one, happen, two, get worse, and through progression, it can continue to get worse. There are several different stages, and ultimately, if it goes untreated, it can end up with an infection in the lymphatic system, which can lead to death. So let's avoid that. You do not, under any circumstances, go from lifting, let's just use bicep curls as an example, doing 1 pound weights to 8 pound weights. You're right. 1 pound seems ridiculous. They're not getting anything out of it. But you know what? You don't know what their body can tolerate. So if you start with 5 pounds and they get lymphedema, you don't know that they would not have had you gone 1 pound, 2 pound, 3 pounds, whatever increments you can. Now remember, they're only at risk in the part of the body that was affected by surgery or treatment. So if I'm at risk in this arm, I can do whatever I want with my lower body. No limitations other than orthopedic. And flip side, if I've had lymph nodes removed or irradiated in my lower body, I have no limitations in my upper body other than orthopedic or some other reason why, because their doctor said they shouldn't. So we always have to listen to the doctor and get a medical clearance. So long story short, whether it's cardio, you start with, let's say, 5 minutes as a base with very little intensity, see how they do, make sure they're not overheating, because as their circulation increases, then of course, so will the lymphatic circulation. And if their body can't process it the same way as it used to, then there's a greater risk of lymphedema. Begin with the exercises that make sense for that person. So, what are you trying to accomplish with a bicep curl? What is your goal? Or are we working to correct posture and stretch the chest and strengthen the back and strengthen the core? Choose exercises that make sense. Start and progress slowly. Monitor for swelling and have your client look for swelling. So over the course of the next 24 hours, they can also do what's called a pitting test. And if you or they take their thumb and you press it into the affected area, it should blanch and refill immediately. But if they have lymphedema, it will hold that indentation, much like if you put your thumb in silly putty. So these are all just some I hope really helpful tidbits of information when working with cancer patients. There is a plethora of information in our Cancer Exercise Specialist Advanced Qualification course or the Breast Cancer Recovery BOSU Specialist course. You can learn more about them on our website at www.thecancerspecialist.com. And if you have any questions, you can call at 503-502-6776. I hope you find this helpful, and I will look forward to seeing you next week. Have a great week.